shining a light on a critical issue. Mental health issues affect millions of people worldwide. Yet there remains a significant stigma around discussing and seeking help for these issues, particularly among men. Many men feel that acknowledging mental health struggles is a sign of weakness, leading to reluctance in talking about their problems, visiting a doctor, or asking for help. Instead, they often turn to alcohol or other substances as a coping mechanism. In the UK, this reluctance has devastating consequences. Approximately 3/4 of people who die by suicide are men. It is crucial to address and understand men's mental health to provide the necessary support and prevent such tragedies. Men at work. The workplace is a significant aspect of life where mental health issues can manifest and sometimes even be exacerbated. Men often face intense pressure to perform, achieve, and provide, which can lead to high stress levels and burnout. The traditional notion of the male breadwinner, combined with a culture that often discourages emotional expression, can create a toxic environment where men feel isolated and unable to seek help. Employers play a crucial role in fostering a supportive work environment. By promoting open discussions about mental health, providing access to counseling services, and encouraging work-life balance, workplaces can help reduce the stigma and support men in managing their mental health. Implementing mental health training for managers and staff can also create a more understanding and empathetic workplace culture. Working with minority communities. Men from minority communities face unique challenges that can exacerbate mental health issues. Racial discrimination, cultural barriers, and socioeconomic disadvantages can contribute to higher stress levels and mental health struggles. Stigma around mental health can be even more pronounced in some minority cultures, where discussing emotional issues is often frowned upon. Organizations and healthcare providers must tailor their approaches to be culturally sensitive and inclusive. This includes hiring diverse staff who can relate to and understand the cultural nuances of different communities, providing language-specific resources, and engaging in outreach programs that educate and destigmatize mental health care within these communities. The impact of suicide. The statistic that approximately 3/4 of people who die by suicide in the UK are men is both alarming and telling. It underscores the urgent need for better mental health support and intervention strategies targeted at men. The impact of suicide extends beyond the individual, affecting families, friends, and entire communities. It leaves a lasting emotional and psychological scar on those left behind. Preventive measures are essential. This includes educating men on the signs of mental health issues and encouraging them to seek help early. Community programs that offer support groups, crisis helplines, and access to mental health professionals can make a significant difference. Additionally, media campaigns that challenge traditional notions of masculinity and promote mental health awareness can help shift public perception and reduce stigma. Working with the next generation. To effect lasting change, it is crucial to focus on the next generation. Young boys and men need to be taught that it is okay to express their emotions and seek help when needed. Schools and educational institutions play a vital role in this by incorporating mental health education into their curricula. Programs that teach emotional intelligence, stress management, and coping skills can equip young men with the tools they need to navigate life's challenges healthfully. Mentorship programs can also be beneficial, where older men who have navigated their mental health challenges can provide guidance and support to younger men. This can create a positive cycle of understanding and openness that gradually erodes the stigma associated with men's mental health. Community involvement and support networks. Building a strong support network is vital for men's mental health. Community involvement can provide a sense of belonging and reduce feelings of isolation. Local organizations, sports clubs, and hobby groups can offer a space where men can connect and share their experiences without judgment. These environments can serve as informal support networks, helping men to open up and find solidarity in shared experiences. Peer support groups specifically focused on mental health can also be highly effective. These groups provide a safe space for men to discuss their feelings, share coping strategies, and receive encouragement from others who understand their struggles. Such initiatives can be facilitated by mental health organizations or community centers, and should be widely promoted to reach those in need. The role of healthcare providers. Healthcare providers have a critical role in addressing men's mental health. General practitioners, therapists, and mental health specialists need to be trained to recognize the signs of mental health issues in men, which can sometimes be masked by physical symptoms or substance use. It's essential for healthcare providers to create a non-judgmental and empathetic environment where men feel comfortable discussing their mental health concerns. Regular mental health screenings should be integrated into routine healthcare visits, and healthcare providers should proactively ask about mental well-being, particularly in high-risk groups. Offering male-specific mental health services and creating outreach programs that engage men in their own communities can also increase access to care. Policy and advocacy. Advocacy and policy changes are necessary to address systemic barriers to men's mental health care. Governments and policymakers must prioritize mental health funding and ensure that services are accessible and affordable. Campaigns that raise awareness and reduce stigma at a national level can shift public perception and encourage more men to seek help. Legislation that mandates mental health education in schools, workplace mental health programs, and comprehensive healthcare coverage for mental health services can create a supportive framework for men to manage their mental health. Advocacy groups can work to influence these policies and provide a voice for men struggling with mental health issues. Promoting healthy lifestyles. Encouraging men to adopt healthy lifestyles can significantly impact their mental health. Physical activity, a balanced diet, and adequate sleep are foundational to overall well-being. Exercise, in particular, has been shown to reduce symptoms of depression and anxiety, and it can be a powerful tool for managing stress. Programs that promote physical health, such as community sports leagues, fitness challenges, and wellness workshops, can be effective in engaging men and providing additional mental health benefits. Educating men about the dangers of substance abuse and offering support for those struggling with addiction can help address one of the common ways men cope with mental health issues. Men's mental health is a multifaceted issue that requires a comprehensive and compassionate approach. By fostering supportive environments at work, addressing the unique needs of minority communities, implementing preventive measures to reduce suicide, educating the next generation, and encouraging healthy lifestyles, we can make significant strides in improving men's mental health. Community involvement, healthcare provider engagement, and robust advocacy efforts are crucial in creating a society where men feel empowered to seek help and support for their mental well-being. It is time to challenge the outdated perceptions of masculinity and ensure that all men have the resources and support they need to lead healthy, fulfilling lives. Men's mental health is a critical issue that requires immediate and sustained attention. By addressing the stigma, creating supportive environments at work, understanding the unique challenges faced by minority communities, preventing suicide, and educating the next generation, we can make significant strides in improving the mental health and well-being of men. It is essential for society to come together, challenge outdated perceptions of masculinity, and ensure that men feel supported in their mental health journeys.